All right, Brandy, I've got straight up 2 o'clock. If you want to go ahead and get started with the recording, we will go ahead and get started with the group learning session today.
Yep, you're good to go.
Thanks. That icon's so little I can barely see it. I'm not able to see the chat either since I put this into full screen mode, and I did not connect a secondary monitor today. That was not smart on my half. All right, welcome everyone. Let's see, it's a little bit, last time it was Thanksgiving and now we're getting ready for Thanksgiving. So I am very excited about the holiday season coming up and know that there are many things for us to be thankful about. So hopefully we can share a little bit of that as we move forward into our session today. My name is Deb Anderson and Brandy Wallen is supporting the session today, and we are recording this. Thank you all for joining us and using your time to participate with us in the Wyoming 1815 work, combining with the care coordination in Wyoming. This is a bit of a extension to the previous Wyoming 1305 chronic disease prevention work, as well as the care coordination work that was initiated by the QIO under their previous contracts. If you wouldn't mind, please be sure you mute your lines if you're not talking. We will be happy to take questions at any point in time, so do not hesitate to come off mute and address any or bring up any questions that you may have throughout the presentation. We don't need to wait for the end. If you do that, some of us may not have a voice left and or may forget what we were actually talking about on that specific slide. The slides, everything again will be made available to you in an email after the recording is prepared and ready to share. So hopefully I've covered everything for housekeeping and we'll get moving forward. So Brandy and I both work for Mountain Pacific Quality Health, and we just wanted to make sure everybody hears about who we are and what we do. We are a collaborative, so we're part of national networks of quality improvement organizations. Mountain Pacific has been doing this work for 45 years out of Montana. There are others who have been doing it as long or longer, and there's some new players in the game as well. So you may be hearing other buzz about QIOs or quality improvement organizations. If there's any confusion, please don't hesitate to reach out and ask us whatever questions you may have. We provide solutions to achieve better care and better population health and to lower healthcare costs through quality improvement. We are a nonprofit, and we do our work generally under larger contracts with folks like CMS, the Offices of Rural Health, the Flex Grants, and state departments of health, as this program is funded through Wyoming Department of Health. So our goals for today, we will do introductions. I don't know that we've got that many folks on, so hopefully everyone gets a chance to introduce themselves. As you do your introductions, and this is your heads up, I would like you to think about sharing a success, something professional, something personal, something that you're proud of. I don't think we do enough to stop and recognize some of the progress that we've made, and so I want everyone to have the opportunity to share something special, something that they're proud of. I've got a couple to share with us as we go through as well. So we're going to be talking about tracking referrals, and in tracking referrals, there's going to be a specific group that we're going to be talking about. We're also going to quickly give you a cross-TX update and have some questions or comments for you as well. We're going to talk a lot about using telehealth, and we have some special guests, I think, that are going to help us with that. And we are also going to maybe have some discussions around provider engagement. Again, we want this to be really, really interactive, so feel free to put questions in the chat and or come off mute and ask questions at any time. So we're going to start with introductions. My name is Deb Anderson. I work for Mountain Pacific Quality Health. I am a health IT geek most of the time, also doing quality improvement consulting. And my current success is I think I am back on the lifestyle change wagon. I have ordered a standing desk, and someday you'll get to see how it works when I have my office cleaned and reorganized. Also, something that those of you who know me might laugh about, but I actually have 2 vacations planned before the end of the year. So I think that's kind of a success for me. So Brandy, would you go next?
Sure. I'm Brandy Wallen. I'm with Mountain Pacific Quality Health. I'm an account manager, and I primarily work on the Wyoming Department of Health contract with Deb. My success is I am completely done with Christmas shopping already.
Congratulations, Brandy. I'm kind of jealous. All right, I'm going to go down
Thank
the
you.
list. I'm going to go down the list. I see Angel next. Angel, would you like to come off mute and introduce yourself to the group? Okay, maybe it's someone from Lander Medical, and they don't realize that their name says Angel, or maybe it's Angel doesn't have audio. Okay, Angel Brissett is a chronic care coordinator with Lander Medical Clinic and Western Family Care, Lander and Riverton area. My success would be keeping my kids and I healthy. Yes, I love that. I did go get my flu shot. All right, I see Adriana Marzette. We know her as Dree.
Good afternoon. My success would be I get to purge the office before I move downtown.
Wow, that's kind of an undertaking. So Dree, I'm not sure everybody on the meeting knows who you are. You want to go ahead and do a full introduction, please?
Sure. Good afternoon, everyone. My name is Adriana Marzette. I go by Dree. I'm with the Wyoming Department of Health Chronic Disease Prevention Program, and I focus on all of the diabetes related efforts within the state, and I just support Brandy and Deb in all of their efforts.
Thank you. We really appreciate that. All right, I say chronic disease prevention, so I'm going to guess that might be Missy.
It is. Hi, I'm Missy Payne. I'm the Chronic Disease Prevention Program Manager, and I think my successes right now, and this may be news to anybody who doesn't know me, I am leaving the program, which isn't really a success, but my success right now is managing to orchestrate and move and all of the things that come with moving out of state and keeping my family sane and fed, all while trying to still work full time, sell our house, and move back to Northeast Colorado.
And take care of a pretty young one as well.
Yes, and take care of my 4-month-old and my 3-year-old. Good times.
That sounds like a pretty big success. And I haven't announced it to the group, but Missy is only with us through the end of November, and we wish her exceptionally well in all of her new endeavors as she moves on and moves back closer to friends and family. So congratulations on your success.
Thank you.
So I see a Hurley Emmy, and I'm going to guess that might be Maureen. Maureen Hurley, are you on? Okay, I see that Hurley Emmy has come off, and I hear typing. You guys are pretty shy if you only want to do your introductions in chat. Okay, Hurley ME, going once, going twice. All right, the next one I see on the screen is MLAHIFF. Randy, would you know who that is?
Hey guys, I'm here. I was unmuting myself. This is Matt Lahiff, and I'm calling in from Cheyenne Regional. I'm our senior practice transformation partner here with our hospital. I do things both inpatient, outpatient, some practice management strategy. So I do a myriad of things that I have my hand on a lot of pots. You know, some successes. I hear people are staying healthy and not getting sick. Well, I'm just coming out of being sick, so I'm going to consider that a win.
Great. Thanks for joining us, Matt. It's awesome to have you here. All right, Rhiannon.
Hi, sorry I couldn't unmute myself. I'm Rhiannon Sterlickson, and I'm with Castle Rock Medical Center. I'm the nurse care coordinator. And I would say that my success in September, I started doing the annual wellness visits here at the clinic. And I think it's really been helpful to my providers and definitely the patients. So I've enjoyed doing that.
Excellent. We might have to have you share some more information with us on another learning session sometime soon. All right, next I see Spencer Weston, Dr. Weston, or Dr. Weston's office.
I am Spencer Weston, CEO and medical doctor for Arrowhead Family Medicine. We're down in the southwest part of the state, and I guess our success is we're getting plugged in more with Wyoming and all of the programs that are available. So appreciate you having us.
Thank you for joining. We appreciate it very much. All right, I think I see Stormy next. Stormy in Thermopolis, are you able to come off mute and introduce yourself? Okay, I'm not seeing much action there, so let's go to chat message. Oh, I see the message from Maureen. Thank you. Sorry about the technical difficulty there, Maureen, with the audio and the video. All right, if I don't hear Stormy, if somebody sees her come off mute later, please let me know. Ty Baker, would you like to introduce yourself?
Sure, my name's Ty Baker. I'm the program manager for at the Wyoming Institute for Disabilities for the health emphasis teams. And that includes, we have programs for ECHO in health, so student health, behavioral health. We also are the home to the Wyoming Telehealth Network, and that's a program that I manage. And then we also have a community participatory research network that is just in its infancy that we're starting, but I'm here with my telehealth hat on. So thank you for sending me the information, and yeah, that's who I am.
Thanks so much for joining us. All right, I see Will. Will from Heritage, are you able to introduce yourself?
My name is Will Weiser. I'm a quality improvement coordinator at Heritage Health Center in Powell. I guess a success for me would be that I am more than 90% done in my data gathering for our PCMH. So that's one less thing I'll have to do.
Wow, that sounds like great progress. And again, there's lots of alignment with some of the work that we're doing here with PCMH reporting as well as MIPS reporting. So maybe we'll tap you for a little bit more information for one of our next learning sessions as well.
Okay.
All right, I think I met Tammy.
Hi, I'm Tammy. I work at South Lincoln Medical Center in Kemmer. I am the education coordinator for the hospital and for their community. And my success is I'm doing ADA diabetic program one-on-one, and I just started it not too long ago. We're not fully recognized yet, but we're getting there, and I actually have 4 patients that I'm seeing already.
Congratulations, nice work. Okay, I'm going to jump to Tracy. I think Tracy's joining us from North Bighorn would be my guess. All right. Oh, I see some chat going on. Oh, Brandy, would you please unmute Tracy's phone? That might be Maureen's issue. Well,
Hey, Deb, this is Tracy. Can you hear me?
I can. Thank you.
Oh, perfect. Oh, great. Okay. So I don't have a mic with my computer. So anyway, so I'm Tracy Walker. I work here at North Bighorn Hospital. I'm the clinic manager and quality director. I've been the quality director for 9 years, so I've seen the facility through meaningful use and now promoting interoperability. I'd say my success, well, we rolled out chronic care management in May, and we are starting a new project with integrated behavioral health in the clinic.
Excellent. Thank you for sharing that. Okay, I've got some phone numbers I don't recognize. Let's try the 605 area code ending in 361.
Hi, can you hear me? This is Penny Case.
I can hear you, but I couldn't quite get the name.
Oh, I'm sorry. I'm in the car right now, so I'm trying to connect. Penny Case. I'm the chronic care manager at Sundance Clinic.
Yes, we got that, Penny.
All right. My success is actually on the road right now to go do my first annual wellness visit in Moorcroft.
Well, we hope you're driving safely and talking hands-free.
Yes. Roads are great, so I'm good.
All right. Excellent. Thank you, Penny. I appreciate that. 307 area code. Last three digits are 558.
Hi, this is Amy. Can you hear me?
Hi, Amy. I can hear you.
All right. My name is Amy Schmidt. I'm with CPESN Wyoming and North Star Pharmacy and Infusion in Cheyenne. And my success, I think, is that my 7-year-old saw his teacher crying after school yesterday or sometime during school. Her dad just passed away in the last month or so. And he took it upon himself to get her her favorite drink, her favorite candy, and wrote her a sweet note and took it to school today.
Wow. That says a lot.
Yeah. He did it all on his own.
We love it when that happens. Maureen Hurley, we can probably try to unmute your phone if you would like. Otherwise, I'm going to read your full introduction there, because I didn't see that you are starting to move your office across the hall. And more than likely, the audio issue could have been that we had you muted from our end. But, oh, I love it. You unpacked your telehealth equipment today. All is well. Excellent. Did I miss anyone for introductions? All right. Oh, actually I did, because I think I saw Dr. Finkelstein. You cannot hide. I see that you have joined us.
Hi, guys.
Hello. Did you see my little screen about introductions and sharing your success?
I just heard the last one. So is that we're introducing ourselves and then just saying something successful? Share a success. Okay.
Yep.
So I'm Lisa Finkelstein. I'm a urologist and the medical director of Telehealth at St. John's Medical Center in Jackson. And the success is making telehealth a priority in Wyoming, and all the things that have that are involved in doing that. And it has been successful. We're creeping and a crawling, but we're being successful.
So one of my other successes was going to be we finally got everybody on a call together. So I'm pretty excited about that as well. Did I miss anyone else, Stormy or anyone who would like to introduce themselves? All right, hearing nothing, remember you can ask questions anywhere along the way, but today we have to talk about tracking referrals, and an interesting thing will be the type of referrals that we track. So remember, the Wyoming 1815 project goal is to implement and track referrals to Centers for Disease Control and Prevention, or the CDC, approved programs. So it says that we're going to take a poll, but you can type into chat, or you can ask to share, raise your hand or something and ask to share information about how if you are currently tracking referrals. And if you type in a yes, then I'd like to know how you are currently tracking them. And while you are working on that, I will tell you that under the program for technical assistance, I get to help any of you who want some assistance to be able to track those either in your electronic health records or via CrossTX if you're going to stay on the CrossTX platform, or if you are a Wi-Fi Wyoming Frontier Information, that's our new state health information exchange participant, there is a way to track referrals there as well. Do I have anyone willing to come off mute and talk about the referrals? Tracy is tracking on Excel. Tracy, could you tell us which type of referrals? Are you doing it for diabetes education? Are you doing it for lifestyle change? Are you doing it for DPP? Anything further on that would be helpful. Oh, Brandy, you got to unmute her.
Thank you. So we track all clinic referrals except referrals for in-house, so like PT or speech, that kind of thing, diabetes education. But all outside referrals, we track on this Excel document.
All right. We might have to visit about that. I'd love to see if we can make that a little bit easier for you.
I would like to make it better, that's for sure.
All right. Thank you for the opportunity. All right, so the next big question in my mind is, where can we make referrals to? Thanks, Amy. I do see your note from the pharmacy. They are tracking referrals through their e-care plans. And I believe that's across the CPSN network, if I'm not mistaken. But if I am, you can certainly correct me on that. Okay. One of the, okay, so our next few slides talk about the places that we can refer our patients to. Obviously, some are going to be for diabetic patients, some for pre-diabetic patients. We can also refer just, patients who are looking for some additional education and support. Again, depending upon the program or the type of program, may have some specific requirements on who they actually accept. So if Susan Krieger is on the line with us, we'd love to unmute her or have her start talking, because one of the things that I noticed in putting the next 3 slides together is for every single one of these program types, Northern Arapaho Diabetes Awareness Program is currently listed for being able to provide all the services, and I felt that she would be someone who would have the knowledge and information to share the differences between the different program types much better than I could. So Brandy, do we know if we have Susan on the line?
Nope, we do not. She's not listed on our participants. Maureen also asked about tracking referrals through CrossTX from your last slide.
All right. So I will have a little bit of information coming up on that as well. So for the projects that we're working on right now, we wanted to give you some of the resources to be able to find the currently listed CDC approved programs. So there are several different sites that we can check. And again, one of our goals is to expand these services, be able to provide these services in other ways. There's going to be one on some of the online programs that may be available as well. And also through telehealth, connect you with folks that may be in your geography or even outside of your geography that can help you with these services. So as you can see, there is a website called diabeteseducator.org, and this site lists the AADE accredited DSMES program sites, and the purple balloons indicate the ADA recognized sites. So this information will be available, and those links will be available in the slides when you receive them. If you need assistance sooner than that, or if you're looking for additional information on things in your area, please reach out and let us know. Brandy, I just missed the chat.
Tammy is asking about how to become CDC approved. She's in the process of becoming ADA recognized.
So basically, once you complete that, you'll be listed on the site. Dree, do you know if that happens automatically? I know there's another site down here that lists those who are working for their recognition.
So when you say CDC approved or for the diabetes prevention programs, which Deb is about to talk about on this next slide, in terms of ADA recognition, how that is that when people say CDC approved, they mean that the CDC recognizes that a diabetes self-management program is, it works. But what you go through is you would go through the American Diabetes Association to become recognized. So they have their own process that you will have to you will become that quality coordinator, and there are just some information that you would submit to them, and then you will update that information every whatever the ADA, right now I'm drawing a blank for ADA, every 2 or 3 years. So instead of submitting data to the CDC every 6 months like you do with the National Diabetes Prevention Program, it's ever X amount of years.
And a lot of times your educators are members of one or both of the organizations that do the recognition. You know, I know that Ashley and Douglas at Memorial Hospital of Converse County is a member in utilizing their systems for reporting. And I know some of the other registered dietitians or diabetic educators around the state are also members of either ADA or AADE. So it kind of depends on maybe what those educators are used to working with, or potentially what had been set up at each of the locations and what the locations have been supporting for more than a few years, I'm sure. Okay, so then we have the lifestyle change programs. And again, there's very few of these in the state of Wyoming, but we are hoping to expand some of these services as well. Dree, I don't know if you want to talk. No, let me go to the next slide, because here's the diabetes prevention programs. And for those of you who don't know, Wyoming Department of Health and Dree have put out an RFA to provide some funding for sites that may be interested in starting their own DPP programs, and it is relatively burdensome, we've discovered. So Dree, do you want to talk a little bit about your RFA? And I know that this due date is coming up very, very quickly, but I think we have a few folks on the line who have already looked at and potentially started putting their applications in.
Okay, so with the RFA that we currently have out, it is to become a diabetes prevention program. So that's this list. So your target population would be those who have pre-diabetes. So if you have a patient that have diabetes, they would not be eligible for this program. They would want to be part of the diabetes self-management program that I was just explaining just a couple of seconds ago. So within the RFA, what we are asking you to do is do some to gather a team. So we would at least like one full-time person, but also we understand the importance of partnership. So if you are a clinic, we recommend that you work with registered dietitians. Starting January of 2020, registered dietitians would be able to bill for all of the Medicaid participants that you have in the program. And then if you apply for our grant, we will give you $15,000 to help with those startup costs with that first year. Usually the program costs $500 a participant, but we do factor that in when we give you the $15,000. So what we're basically giving you is the cost of the program for 1 year. After that 1 year, we will give you that support to help you become a Medicare supplier. To become a Medicare supplier, please listen to this closely because this is the purpose of our grant. You must have at least 5 participants who reach 5 to 7% of weight loss. They have to have had an average amount of 150 minutes of physical activity weekly, so 30 minutes a day. And then they must have attended a total of 9 sessions in the first 6 months when you report to the CDC. And when you report again that second time, they should have attended 3 sessions. So a total of attending 12 sessions. So let me repeat that again. 12 sessions, 150 minutes of weekly physical activity, and lost 5 to 7% weight loss. And another requirement, because we do recommend you read those 2018 standards, 35% of the participants in your cohort must be provider referred, which is why Deb is really pushing that referral aspect. You must have that referral. They are really pushing that because evidence show that when providers refer patients, they're more likely to complete that program. Here in this state, we have a struggle with participation because a lot of our providers are not referring. So if there is a provider on this phone call, please refer. If you need a referral form, please reach out to me. I can give you those forms. If you contact, if you don't get the DPAC newsletter, let me know. All of those resources are in the DPAC newsletter. But again, the RFA is to help you become CDC recognized so that you can become a Medicare supplier, so that you will be able to bill for your Medicaid participants as well as your Medicare participants. And then currently, it seems that United Healthcare covers the program, and I am working so that Cigna and Blue Cross and Blue Shield will start covering the program. So that's what I'm doing on the state side. I'm working with increasing coverage for these programs. But if anyone has any questions, I will in the chat pull up the link to the web page for you so you can see what the PDF, what that RFA is, and then the closing date is on the 25th. So if anyone is interested, please do not hesitate. And if you do not want to apply to the grant, but you are still interested in implementing the program, but you do not want to go through the process, let me know so I can get you into scheduled for a lifestyle coach training next year. And then I, Adriana Marzette, can send you those materials so you don't have to pay out of pocket.
Thank you. One more slide for you, Dree. Would you, here is a list of the online, some of the online programs.
Okay.
And I know that I heard at the STEM meeting back in May.
Correct. So we, so here in the state, as you all know, we currently do not offer the diabetes prevention program online or via telehealth. Telehealth is something that we will be starting in 2020. Medicaid is completely on board. We're just looking for someone that's willing to pilot with us. Also, OMADA would be available to all state employees and their benefits starting January.
I have a question. Oh,
yes,
sorry.
ma'am.
This is Ty from the Wyoming Telehealth Network. When you say that you guys are going to be starting telehealth in 2020, what does that mean exactly?
So starting telehealth is we will be starting conversations with the University of Wyoming, what's the wind?
Oh, that would be me. Yeah.
Okay. So do you know Alyssa Kennett and
Yes.
James
Yeah.
Bush? Okay,
Yeah.
so those are my two contacts. And
Okay.
starting January, we were supposed to reach out to you because Medicaid, Alyssa Kennett has the license for the telehealth.
Perfect. Yay.
And
That
we
makes
was
me so happy.
and we was just going to like see if you all would be interested, and because Medicaid is supporting it and the coverage their Medicaid reimbursement will cover telehealth. We wanted
Perfect.
to
Yeah.
expand that to all of Wyoming because we know everyone can't do it in person, and we just want to scale our program to a larger
Perfect. Thank you. I'm excited to have conversations with you. I'll put my email in the chat.
Okay.
Deb, you're cracking me up.
Can we count this as another success? Yay!
Yeah, absolutely. This is a success. I'm sure Lisa, Dr. Finkelstein is just like jumping up and down too. But yeah, diabetes, all of this concept has been something in the forefront of our minds. So I'm glad that this connection can take place. And sorry I don't have my camera on to like virtually meet you. I have had a crazy travel day coming back from DC, and so I'm just
it's
stay
totally
off the video for right
Yes.
now. But I'll put my email in and a couple of the other people, and we can touch base whenever you're available.
Sure. So we wasn't planning to meet to January, but I can definitely do some soft introductions, and maybe
Perfect.
we can do like an intro call next month, and then officially have like our meeting in January to talk next steps once the codes have been released.
That sounds amazing. Thank you,
Okay.
Adriana.
I'm sorry, everyone else. I just took up your time right then.
One more thing, Dree. Would you tell everybody about the Wyoming transportation workers who are currently enrolled in Omada?
Yes. So the reason that we decided to promote telehealth at Omada is because in year one of my grant, I was able to partner with the Department of Ed bus drivers. At the time, it was Justin Budd. He has since been promoted, and now I'm working with another Justin Arnold. But what we was able to do is pilot the Omada program, which is the online DPP. So instead of coming in person, you would be able to log in on your cell phone or on a desktop or laptop and take the classes at your own pace online, like an online course. And we have had 93 bus drivers to start this program. I had a meeting of those 93, about 47% have already lost that 5 to 7% weight loss that they're supposed to lose, is now just maintaining it to the end of the program. And then also most of them have been able to like hit those 150 minutes of physical activity. They have seen a decline since it's starting to get cold, because in the summertime they had developed walking groups. So we're having to do some cheat sheets on what you can do in the wintertime to get those physical activities minutes up. I myself am guilty of that, but it has been very beneficial. And the things that we hear about the online program is that they like it most because they don't have to commit to coming in person. They can do it at their own pace, just on like a lunch break or between after they lay their kids to bed.
Excellent. Thank you very much, Dree. That's great work. I certainly appreciate all of the things that you've been doing. Ty, I see your information in the chat, and I appreciate that as well. So really quickly, since we're going to have to run through the last few slides, for those of you who are using CrossTX, want to continue to use CrossTX, please check with us on the expiration of your subscription that we have paid for. It is possible for us to potentially have some funding available for some renewal assistance. And Maureen, if you're interested in using CrossTX for tracking referrals, that would be a piece that we would want to have in place for you as well. Brandy, the chat's not coming up quickly for me, so I'm going to keep going and you can interrupt if there's some more questions. All right, so let's jump into the telehealth piece. So one of the things that I will consider this a success is because we have talked about introducing or connecting you chronic care coordinators with providers within the state of Wyoming to help you with your chronic care patients. So picture this. You have someone who needs some specialty care, maybe has some transportation issues, maybe has limited income, has an issue with getting several hours to places for checkups. We want to help you work to connect them with board certified Wyoming specialists right in your office. Now, when I mean right in your office, I mean right in your office. Currently, the reimbursement would be that person to be within the walls of the clinic. There are a few Medicaid approved codes for telehealth, but we would have to look at those specifically before we would know exactly what would work as for a reimbursement model. But here is the WIND slide. So Wyoming Telehealth, and this is Ty, who you now have all of her contact information as well. There is a wonderful website out there that talks about their mission and their vision. And one of their greatest supporters has been Dr. Finkelstein, and I will introduce her here in just a second. Out on the website, you will see recorded webinars. You will see a list of their telehealth providers. For providers, there are toolkits to get them started doing telehealth. And then there's additional links to news and education and regional trainings. So as you can see, there's a wonderful Wyoming Med or Wyoming Medical Society little blurb on there as well. And I'm not sure, I haven't seen it. I don't know if Dr. Finkelstein stars in that one as well. A couple things I wanted you to know. There are telehealth resource centers as well. The links from WIND, I think, would take you there. And there are representatives from the telehealth network that participate in our telehealth resource centers. And I believe, if I'm not mistaken, Dr. Finkelstein is one of our new board representatives. The other thing to think about before we get too excited about doing telehealth is that you will need to know your bandwidth. Some places will indicate that they have some issues with this, and I know we've done, Dr. Bush and the group has done a lot of work around Wyoming trying to make sure that bandwidth and internet connectivity is not an issue, but the link to the Wyoming broadband map, A, shows you some additional information, but B, it also tests your speed. And the more places we can get to test their speeds, the more information the Business Council and the broadband folks are going to have to help us continue to improve and expand our bandwidth. So without further ado, I would love to introduce you to Dr. Lisa Finkelstein. This is something that's been in the works for a long time, so I'm going to be quiet and let her talk about how we want to continue to promote telehealth around Wyoming.
Well, this is another energetic group and a lot going on. I love Adriana's energy and her smile. I can't see her, but I can see her picture, and it's pretty awesome. As you guys know better than anybody, treating patients from their home or in their community is really where it's at and where it's headed. And unless you live under a rock, you know that telemedicine and telehealth and all sorts of innovation in healthcare are happening because our system is just so broken. And Ty is one of the champions also working at WIND, and at the university we have a staff that's also trying to help move this message forward. But the reality is the last mile, we call it, is trying to get providers, doctors, to engage in the process, and then also patients. Just like you were saying for the bus drivers, that once you show them that they don't have to get in their buses and their trucks to take a test and they can do it online, the convenience of that. And once they understand the technology, it doesn't take much for them to get it. Same thing with telehealth. There's really so much to talk about. There's really no aspect of medicine that can't be touched with telemedicine. So the benefits, extending the care team, which is all of you, which are trying to keep people healthy in the state of Wyoming, which is ultimately the goal. By improving care and follow-up, engaging the patient and the family, which is much easier if you're doing it in their home or in their community. And then improve patient satisfaction. Well, it's been proven over and over that telehealth reaches 90–95% patient satisfaction virtually. This is kind of an example. We're doing a Zoom telehealth type video conferencing administration meeting. It's not as necessarily as good as face-to-face, but it helps all of us so that we can not have to spend time and travel, and we can still have a meaningful meeting. So Deb, how provider engagement, do your providers support telehealth? What are the barriers and how can we help? So my job as a doctor, I'm a urologist and the medical director at our hospital. Honestly, I really didn't know how difficult we were until I tried to engage doctors into a new concept. And I'm sure you guys already know that. But physicians are not easily swayed and easily convinced that telehealth is worth their while because they're so overwhelmed with what they have to deal with. So that's my job, is to try to engage them and make it seem easy. The barriers are, for physicians, one of the barriers that they perceive, and I'm sure you guys know, is how to get paid. And that's part of, like Adriana was saying, is working with the payers so that they jump on board full speed ahead. We have the best champion ever in Dr. Bush, Jim Bush, who's an internal medicine doctor, who has been trying to promote telemedicine since 2008. And he's in it for the long haul. It's really been just the past couple of years that we've made significant headway, but he's in it for the long haul, and this is a marathon for sure. So how can we help? Deb, what do you mean by we? Who's the we?
I would like to hear from the chronic care coordinators, how we can help them maybe get in contact with their providers, provide some additional information on telehealth to the providers, help with their barriers. So what are the things that they think that this Wyoming Telehealth Network, you and I, others on this call can help with so that we can engage more providers and more patients?
Well, I can start the conversation by saying, as a physician, it really is difficult for me to understand exactly what all of you guys do. And I've said that to Deb in a way that, and I don't mean this in any offense, it's just that you guys speak a different language than we do. And chronic care management and all the things that you guys were just talking about is very new to me. I'm happy to engage and help if patients, let's say you needed urologic consultation. I am one of those providers that utilizes telehealth in my practice and would be able to use Zoom to do that. And we could use the proper billing and coding as long as we're paying attention to the rules. So that's, let me start by saying that.
So Ty is asking if we could maybe describe what an encounter would look like. And in my conversations with providers around the state, and then doing a few of the presentations as well, is that, we have the specialists like you who say, I don't have someone in Riverton, I don't have someone in Evanston, I don't have someone, at a specific place that I can help bring the patients and help me see the patients in their communities. So I truly believe that this group is the group that can help us see more patients in their communities. And so, they consult and arrange care and coordinate care and find community resources for the patients that they have enrolled in chronic care management. And so this would be just another extension of the great service that they could provide to their chronic care patients. And they're part of team-based care because their provider referred this particular patient into the chronic care management program, and they work with them on medications and transportation and several different issues. So they have this great trusted relationship. Many of them have enough clinical experience that they can bring the patient in, they can check the patient in, they can help the patient make the connection for telehealth. So again, this is kind of like this connecting point where we have these great people who are working with their patients, and we have providers who want to help support and expand telehealth, and we need to figure out the way to bring this together.
Well, as Ty, it's, I wish it was simple, but as Ty knows that our telehealth network is what we're trying to use that as the hub. It does require getting a Zoom HIPAA compliant license so that if you go on the website and sign up as a provider, then it's just like Deb did to all of us today, sending out a link, inviting us to this conference. It would have to be that type of thing, at least for right now, where we're utilizing Zoom to make that encounter happen. So that would be the first step.
So many of these may be at primary care locations. So while their providers may not want to be the people who provide the telehealth service, I think they would be the providers we might need to talk to about what specialty services we can bring through their chronic care coordinators or through their Zoom licenses in so that we make those community connection to the specialty provider. So I don't know if we have a coordinator on the line who would like to talk about the opportunity for a patient to do a teleconsult with a urologist. I mean, that's what we're talking about at this moment, but there's several other providers that we are trying to focus and highlight that can provide services remotely as well via telehealth. Do we have anyone in our group who has used telehealth before with any of the chronic care patients? Do we have anyone who wants to be a guinea pig and be a pilot flight for us?
And Deb just made a good point. One of the ways that I have started to make, there we go. Our clinics have used telehealth. Angel.
Yep, that's down in Lander.
Oh, Angel, yes, you guys. So we are, yes. So Lander is one of the clinics that is actively utilizing Zoom and telehealth, and they are an originating site. So that would be a great example. And really all it does, it takes one patient, one guinea pig, and one provider. I mean, you could use me as an experiment. And that's what ends up happening is physicians start to see other physicians utilizing it. It's like that zebra just dipping its toe into the river and then all 5,000 zebras follow. There's a list on the website of providers that are interested.
I've got a few more slides. I was just going to go through really quickly because we've got, registered dietitians. We have, the diabetes educators. There's a few more, and I think Brandy is working on putting together a little bit of a packet on some of the specialists that we feel may help us increase the referrals and bring more education and opportunities to the chronic care patients. So again, what we're really looking for is who's willing to be the first zebra to put their toe in the water.
Yeah, I mean, it's billable origination site fee, which is that Lander clinic, which is where the patient goes to that clinic, which we call the originating site. That Lander clinic can bill. It's a small fee that they recoup from Medicare, Medicaid, $20, $25. Medicaid, though, as you guys were saying, Dr. Bush, the champion, allows the specialist to see the patient from their home. So if you have a Medicaid patient that wants to engage with a physician that wants to do telehealth, they can do it from their house. They don't have to go to an originating site clinic, which is huge. Eventually, we're hoping that Medicare will head in that direction.
And there is a little bit of movement, it sounds like. However, again, with Medicaid, a couple things that you have to think about is, depending upon what the provider is looking for, do they need vitals and other information from the patient that it may be better to take in a clinic versus at the home? And also, our Medicare age folks as tech savvy as some of our younger folks are. So I think, again, we'll have some challenges and some barriers, but what we want to do is we want to keep pushing people to cross the stream. So I don't know how many of you had seen the webinar that Faith had done, but she did a relationship-based telehealth webinar on utilizing telehealth in your care coordination program. The link is available to the recording and the slides as well. So hopefully, if you're interested, you will not only reach out to us, but maybe do a little bit more to see how Faith has indicated this can be incorporated in the chronic care management program. And the chronic care management time, any time that you spend setting up those appointments, working on the referral documentation, whatever is needed for that specialist, is billable chronic care time. Okay, so what we have is just a few more slides left. I know we're running really short on time, but it's been wonderful discussions. So if you have questions, please don't not ask them yet. You can go ahead and put them in chat. There are CDC telehealth guides for diabetes prevention programs in telehealth. This is something that we will be looking at more closely and working with some of the DPP sites in order to try to implement more telehealth across the state of Wyoming. And then we have a few updates, and Brandy, I'm just going to go ahead and go through these really quick. Sorry if you wanted to talk. Brandy will be sending out some invitations to join our Google groups so that you can start receiving emails and messages regarding our monthly education sessions, as well as resources, as well as some of the affinity group information that we'll be sending out. Brandy is working hard now on creating the a self-measured blood pressure program affinity group, as well as hypertension control group. So I am sure that you'll be seeing some information come across your Google group emails, and please make sure you reach out to us if you are ready, willing, and able to start participating in those groups. I don't know at this point, it doesn't look like it's going to be too technology related, so it wouldn't matter if you're using different EHRs. And then some of you may have received this, but anybody who hasn't, Faith's classes are now being supported by WYCOA. And so if you are interested in any of her training programs like annual wellness visits, chronic care coordination, and advanced care planning, you would be able to sign up for her online learning classes at no charge, because it is sponsored by the University of Wyoming Center on Aging. And then really quick, for those of you who have been waiting and waiting and waiting like we have just received our CMS Quality Improvement Organization contract, a task order 1, the very first one. And so what that will be focusing on is improving behavioral health outcomes, including opioid misuse, increasing patient safety, improving chronic disease self-management, improving quality of care transitions, improving nursing home quality, and engaging and activating patients, residents, and families and caregivers as part of the healthcare team. So do you see how much of this aligns with some of the things that we've just talked about and the work that we will be doing with Department of Health under 1815 as well? Many of you might be receiving some information about how the QIO will recruit clinics and partners into our work as well. We do cross-recruit, so more than likely those of you who have agreed to participate in 1815 will also get the benefits of participating in the QIO work as well. Okay, questions are anything that you have that we didn't cover today, or any additional follow-ups that you would like us to do as a group or individually. And so you know, our next meeting date is December 19th at 2 p.m. via Zoom. and it's going to talk about how your work improves quality scores like PCMH, Will, there you go, or MIPS, the MIPS quality reporting, and other quality reporting programs as well. So when we send out the invitations, we would appreciate if you are not the quality improvement person or you're not the IT support person, that you go ahead and share the invite so they can join us as well. Do we have questions in the chat?
No, we do not.
Do we have anyone brave enough to come off mute and ask any questions at this point in time? Phew, we made it through with 1 minute to spare. Thank you all for joining us. We do certainly appreciate your time. Please follow up with Brandy or I if you have any questions or concerns, and you will see the link to the recording and the additional resources come out very soon from Brandy in the Casper office. Have a wonderful day.